From the Dignity Health Studio at the Bakersfield Californian, this is Live Well, your weekly look at all things great about living in Bakersfield and Kern County. And now, here's your host, Lisa Krch.
Good morning, everyone. Welcome to Live Well. I'm your host, Lisa Krch. Scott's here. We'll tell you more about that coming up in just a few minutes. It is Wednesday on May 28th, where every week the pages of Be Well and Bakersfield Life magazines come to life, showcasing living well right here in Bakersfield and beyond. Again, I am your host, Lisa Krch. We are coming to you live this morning from the Dignity Health Studios right here at the Bakersfield Californian. And I'm also, as I mentioned, joined by Scott Cox. We are mixing things up quite a bit for you today. For the first two segments today, Scott and I will be on the receiving end of a pretty nifty non-surgically invasive procedure. Did I get that right? Our friends at Beautologie are here with us this morning. They brought along some very fancy equipment. It's a non-invasive venous freeze. Apparently it has no downtime, no pain. We'll ask Scott about that because for the last 45 minutes or so, he's been having the treatment done. Many patients, including Scott, say it feels a lot like having a warm massage. You can get more information about that by sticking around here our show for the next two segments and also by going to beautologie.com/Venus Freeze. Coming up at the bottom of the hour today, we'll preview the big June high school graduate issue of Bakersfield Life magazine, which is coming out this weekend. A little later on, we're going to also introduce you to some of the grads that are going to be featured in some of the area's brightest high school seniors that are headed off to very prestigious institutions of higher learning. And as we know, behind every successful graduate is a support system of parents, and so we'll visit with a couple of them as well. But first, on to the demonstration. We have Dr. Shah joining us today from Beautologie. We have
Lisa.
Nurse Lilly. Thank you both for joining us. We appreciate your time very much.
Thanks for having us.
And as we mentioned, Scott was getting this procedure done, and I wish we had some pictures to show you exactly what that looked like. Yeah, Scott's saying
Very dark time for me.
He wishes he didn't have any pictures of that. So, Dr. Shah, let's start with you. Tell us what this procedure is about and how it works.
Sure. So the Venus Freeze laser, it actually is a laser that's come out after years and years of experimenting with radio frequency technology. And what radio frequency is, it's a type of energy that does two things. It actually stimulates collagen, which means we're bringing healthy new skin out to the surface that's tighter, that's firmer. And we're actually shrinking fat cells down with this same radio frequency energy. And so we can go after, with Scott, a stubborn pocket of fat that he's been working on. We could go after things like that, or we could go after areas where, as we age, we've lost elasticity, where things are starting to droop.
And so with Scott, you mentioned we went after some pockets. So, Scott, tell us what that experience was like. You were a very big boy. You did a good job.
I was a big boy.
Yes,
I think I
you
get a
were.
balloon, is my understanding.
You should get a balloon or a sucker
I have.
or something.
I lost 50 pounds, and I ended up, because I ate right and exercised. It was weird. It took a year. But what I found, even like now, it's like 18 months in, and you still have these like little blobs of fat on the side. And I just got obsessed with getting rid of them because when you go to all that work and adjust your diet and you do everything you're supposed to do, it starts to make you mad. I'm really mad at this. Mm-hmm. So Lily took her little shower head thing there and did the thing, and so now it's all still tingly, which I'm assuming is the death of fat cells. I'm very pleased with that.
Yes.
But you could sit there and hold a conversation like I did. It's certainly non-invasive. You could do it just while you're doing your job. I can imagine going into Beautologie and laying down and doing it. It's rather nice.
Well, this is quite a treat today because this isn't normally something that you do house calls with. So you bringing this to us today is a very special.
Oh, and they're leaving it.
They're leaving
They won't use it every day. Just when
I know a lot of people have asked you to, yes.
Yeah, no, absolutely. The Venus Freeze laser, I mean, it's, we have two of these devices at our Bakersfield office, and we use it almost all day long. This laser is going, Lilly, of course, operates it along with my other two nurses, and this is such a popular treatment, and we're so fortunate to have the ability to bring one over here to the office and really kind of share the technology with everybody out there, all your viewers.
This is really, I don't know if we can get a shot of this, but Lily, can you kind of walk us through exactly what this thing is and how it works?
Yes, so right here it tells you the areas that you want to work on. So like this, for example, is the face, and then it kind of has the preset times in there for you. And then so we have a small handpiece and we have a larger handpiece, and it depends the areas we're going to do. So for the face and neck, we would use that one. For face and neck would be this one. Bigger body areas would be the larger one.
And what is the time that you do each procedure for in each part of the body?
It kind of depends, but for the face, we always do 25 minutes. For the neck, we do about 20 minutes. For larger areas, depending on what size the person is, we kind of adjust the time to them.
And what kind of special training did it take to run a laser? I mean, is that what it says on your resume? I run a cool laser? Because that's what I put on mine.
Well, I do a lot of lasers at Beautologie, but we actually got trained by the Venus Freeze company, which is, they came in and they trained us. We did a couple of trainings with them.
That's really, really neat. Well, thank you so much for bringing that in. I know that was not easy to get up the stairs.
Yeah, we had help out there. We used that freight elevator, and
Very
we
good.
made it over. So.
Well, who would this type of a treatment be good for? Obviously, Scott, and he'd mentioned he'd lost so much of that weight and had some stubborn spots. Who else would be a good candidate for something like this?
So, we have two groups of people. Those that are looking to turn back the clock and, guys, gals that are starting to notice the jowls on their neck or maybe the creases across their neck or with the arms start to lose a little bit of elasticity. So to tighten up the skin in any of those areas, you'd be a great candidate for. And then the other group of patients are patients, again, that want to just kind of lose a little bit of that stubborn fat pocket, whether it be in the belly, the love handles, the back, the thighs. So, really it's a very versatile treatment. It's used for all age groups, and we just have to, make sure they're a good candidate. And of course, there are some patients where if they're looking for something a little bit more dramatic, a little bit more of a quicker fix, we'll send them over to the surgical side of the practice.
Very good. So is there anybody that this wouldn't work for?
Well,
who would be a better candidate for lipo than, say, this?
Yeah, exactly. So, a patient that has a lot to go after, and say they're preparing for something that's really quick, something where, they have a wedding to attend in a month or so, and they're looking for that quick result, and there's a lot of pockets of fat, or sometimes after having multiple kids, there's a large overhang of that skin, and this can only give you a couple inches of tightening. So if we're looking to really remove a lot of that loose skin, then a surgical tummy tuck would be the better option.
Now, how long does it take to see results? Scott had a great treatment today. Was it a total of 25, 30 minutes
Something
that
like
you
that.
underwent that?
Seemed like less.
I should ask the lady in charge of the laser.
It was about 20 minutes.
20 minutes, very specific areas targeted. So would he see any dramatic results today, or how long would that take?
So, there are a handful of patients that will see results just after the first treatment, and sometimes it takes a couple days. Once we've actually set and processed this motion of collagen stimulation and breaking down fat cells, it's shown in literature and, of course, in practice that these results get better and better up to 2 to 3 months out. So generally, patients will come in once a week. We'll do a series of treatments. Usually, it's about an 8-week course. And then we wait about 2 or 3 months after that last treatment to see the full effect. So the maximum benefit is about 5 months after you first get started with your treatments. But we very commonly have patients that will come in week after week and tell us how wonderful how their pants are fitting, or their friends are telling them that they look a little bit more fresher, or more lively or youthful. And so it's very, very common to see results just after a treatment or two.
This is really cutting edge stuff, then, isn't it?
It is, yes. No, we're really happy to have it.
How long have you had it there at Beautologie?
So the Venus Freeze we've had in our office for about 2 years. We actually had a second one that we purchased about 6 months ago because the demand of it was so high, and now we have one at our Fresno office as well. It's a very, very popular treatment. Again, this type of energy has been out for a long time. We've been using radio frequency to tighten up skin for many, many years, even, I would say 10 years now, longer than I've been in practice. And they've figured out how to improve the technology, and we've gotten the ability now to do large areas very comfortably with very little downtime.
And quickly, also.
And quickly.
Well, we are going to have you stick around. And Scott, if you wouldn't mind hanging out for a few more minutes, we want to check in and see how you're
I've
recovering.
got no place else to go.
Thank you so much. So we're going to take a quick break. When we come back, we'll have an actual demonstration with the Venus Freeze. And if you think I'm going to let them leave here without trying it on me, you're crazy. So we're going to do that next as well. You are watching Live Well on Bakersfield.com. And good morning, everyone. Welcome back to Live Well. I am your host, Lisa Krch, and I am joined by Scott Cox. He is not currently in the studio, but I have a feeling he will be back because Scott underwent a really neat, non-surgically invasive procedure this morning. It is called the Venus Freeze, and we're going to continue our demonstration with me because because I'm excited about it, and I'm really excited you guys are here. Our friends from Beautologie are joining us this morning. We have Dr. Shah. Thank you so much for coming in. Always great to see you. And he brought along Nurse Lilly, who is in charge of this Venus Freeze machine that it's very special. We even have it here in studio because this thing doesn't usually make house calls. So we appreciate you guys, showing up with your fabulous machine. So for those of you who haven't seen this, give us a quick idea of what this machine is, and then maybe we'll start talking about what we're going to do here.
Sure.
Thanks.
So again, this machine is a wonderful machine to go after two things. One is actually tightening areas where we've lost elasticity, where things are starting to go south just because of age and gravity, and also to go after areas, stubborn pockets of fat, to reduce the circumference, like areas like the belly or the thighs. And on Scott, we tried out going after those pockets of fat, and Lisa, you look wonderful. You don't really need anything, but what I think we could demonstrate with this machine is also its preventative benefits as well. And one of the biggest things we go after in our practice is the lower face and neck area, the jowls, and the laxity that you get in the neck. And so just by starting it before it's too late, you're stopping the clock with this laser. And maybe if you don't mind, we could demonstrate the skin tightening benefits of the Venus Freeze.
Absolutely. And hi, Scott. Welcome back. Okay. So those of you who didn't see the end of his show today, he actually had this treatment as well, and it was about 25 minutes or so, and it was very targeted specifically to pockets on the back. And
right, 25 minutes, and
we showed on camera.
We did show on camera. And how do you feel? No pain? No.
I kind of like it now because it's tingling, which means it's like
it's working.
Something went on down there.
Cool.
I'm for that.
Okay.
So I'm kind of liking it.
Well, I'm ready, so you might have to help me talk while I be quiet and let them do their magic.
All right.
Thank you, sir.
So here, I can hold your mic for you if you'd like, Lisa. And so what we're going to try out on you, Lisa, first is we're going to put some of the gel on, and the gel is actually something to help the machine work the way it's supposed to. Conducts that energy, that radio frequency laser energy deep down to its target. And so Lily's going to put a little bit of gel on your jowls and neck area.
Your jowls! Lisa Krch's jowls.
Oh, jeez.
We're going to work on Lisa's jowls.
Thank you. Good luck with that.
You don't. I don't get it because you don't have any really jowls.
She sure doesn't, and that's why I said, what we're doing here is more preventative, and of course Lisa's allowing us to demonstrate this on air. We're going after a whole different target area, but in most cases we're actually tightening the area. We're going after that loose skin. In Lisa's case, we're just giving her the preventative benefit of it.
Is Lisa where she tilts her head back like that it gets this awkward camera angle that makes her just look weird? People, if you're just tuning in thinking, what happened to Lisa? This is like a crime scene photo.
Right.
Well, it's when you're done, it's like super taut.
There we go.
All covered in gel. Wait till you get to the next. Now, is this going to be the same basic temperature that it was used on me?
Actually, we're going to use a little bit of a lower temperature. The skin tightening temperatures don't have to be quite as hot. We're working on the top layer of skin, the epidermal and dermal layer of skin, not targeting fat, so we don't have to go as deep.
Interestingly enough, it is interfering with my IFB, so I'm going to take it.
That's a good idea. Yeah, absolutely.
That's just because of
The radio waves, the radio frequency waves, just like the radio waves we're using here, it does use radio frequency and magnetic pulses. So yeah, we should probably get rid of that, but I can hold the mic whenever you want.
Thank you. Okay, guys, I'm working without a net, so you have to tell me what time to wrap this up. It's warm. It doesn't hurt at all.
It gets hotter.
Soothing, actually.
Yeah. I mean,
So much hotter.
it gets warmer, but if it gets a bit too uncomfortable, Lily's monitoring your temperature right now. But if it gets too uncomfortable, we of course want you to let us know. It's not meant to be an uncomfortable procedure. It's supposed to be very, very comfortable. It is supposed to be soothing, relaxing. A little bit of warmth.
Now, is it going to get like bright pink like I did?
It'll get a little pink, and that tells us, again, that's an endpoint that we're looking for. That tells us we've reached that therapeutic temperature where it's actually doing its thing, where it's tightening skin.
And the skin tightening is kind of a natural thing that happens when the fat cells underneath it die and go away. The skin's going to tighten up around it.
No, not necessarily. So again, two different things here. When we use the higher temperatures, we're going after fat cells. We're shrinking the fat cells. We're getting rid of those triglycerides, turning them to a smaller free fatty acid. So what we're doing in Lisa's case is we're using lower temperatures where we're just targeting collagen and elastin fibers. We're waking them up. So
yeah, because she doesn't have any fat on her neck. That didn't. Okay, well I get it now. So this is just to make her skin really super tight. Like a drum, like a snare drum.
Well, isn't that when ladies at the first time or the first signs of aging? Isn't that when the neck starts to starts to get loosey-goosey like a turkey.
Yes, absolutely. Yeah, you know, the neck is something that we always kind of forget about, and there's all of a sudden just, you know, jumps out at us. We're always worried about, you know, fine lines, wrinkles on the face, and then all of a sudden that neck starts to loses elasticity, and we forget about it. So this is one of the few treatments that works wonderfully to keep the neck and the face in balance. You know, keep that that tautness, that elasticity retained. And so, yeah, and it's a very common complaint of not just our gals, but our guys as well. We get a lot of guys that come in to do their neck.
I didn't know there was anything that you really could do, because I've always heard that the way that you can tell if people have had work done on the face is that their face is real tight, real taut, but then their neck just doesn't quite match. And so this is something that could remedy both of those things.
Yes, absolutely. I mean, that's, you know, when cosmetic and plastic surgery started becoming very, very popular, the face was, you know, really focused on, but everybody missed the neck. So that is a common complaint. But now, you know, in this day and age, we do have a lot of things that work on the neck. And this, well, not a lot of things, a few things like this. We do have our chemical peels. And of course, if you need anything more surgical, you know, a little bit more dramatic, then we have the neck lift surgery.
Would you put this particular thing all the way up on the face?
Yes, absolutely. So we go after a looseness in the cheeks.
Now let's see how you like it.
we go after the eyelids as well. When the eyelids start to droop, we'll go after the eyelids. You know, the cheeks as well. I mean, just about any area where you're starting to lose that elasticity again.
So if I was concerned today about not blending my makeup good enough for something like this, now it's two completely different colors, right?
Well, it looks like a nice blush actually on your.
I like that.
The only problem is your nice blush is on your neck, which is not your normal, you know, blush site.
Well, can this also do removal of spots? I know that as I age, that I am having some brown spots that I just cannot get rid of. Is this something that could help with that?
So that is actually.
Chemical peel type of an issue.
It's actually a different laser altogether. This laser bypasses the surface layer of skin. It goes right down to its target, which is much deeper down. You know, it's going down to the dermal layer of skin, to, you know, a couple layers down. It's going after to stimulate collagen. When you're going after spots, that's more on the surface of the skin. And we have another laser called our photofacial laser that goes directly after those spots, causes a controlled burn of those spots, and gets rid of them, actually.
Boy, this is very soothing. I might just close my eyes here for a second. This is very.
Here's why you and I are heroes, because like that cat, this should be a very private moment that you're sharing with the entire world. Did you ever think?
Yeah.
How many people on a
that.
given day see your chin from that angle?
Only my boys, and only because they're shorter than me.
Well, now it's everybody. So congratulations. Plus, I took a bunch of pictures that are going to be on Facebook
That's
immediately.
Awesome.
Yeah.
We appreciate you guys being good sports about this, and you know, and a lot of times, you know, clients, patients, they don't really know what to expect, and we're just out here to give them the information they need. So that just tells us that we've reached the 5-minute mark, and so we've done a pretty good job. What temperature did we get to? 41. Okay, so a good temperature to, again, you know, firm up that skin, tighten that skin up, and so Lily's going to keep going here. Any other questions that you have?
Will there be any special treatment or anything I need to worry about today as far as recovery or downtime or not wearing makeup or?
That's a good question. Actually, with this laser, there's not as many restrictions as some of our other treatments. You know, with this, you're a little flushed. You know, there's heat that's kind of retained underneath the skin. So we don't want you going out there and running a marathon right after the treatment, getting too much sun. Maybe not sit in a hot tub or take a hot shower. But other than that, you know, once that redness kind of dissipates, there's no real restrictions. You're free to go about your daily activity. I mean, you could even exercise later on today or tonight. That's not a problem. And makeup, no real restrictions. We're not really peeling the skin again. We're working deep down. So there's no other restrictions other than that.
I am so happy to be in the room while this is going on. No, just watch it. Now it feels warm, but in fact you're freezing.
Well, okay, so the Venus freeze, what the freeze really means is we're freezing time.
Oh,
we're
okay.
freezing time. And what we're actually using the energies that we're using are radio frequency and magnetic pulses. There's actually magnetic pulses that are being delivered as well. And those are the two energies that are, again, working on that elastin and collagen. But no, the freeze part of it means that it tells us that we're freezing
just the
time.
sensation that you get, because I still feel it. It's not like a burning. It's more like when you cut like ice after you know, it's something
Right.
so cold that it burns.
Yeah.
It feels a lot more like that.
More of a tingle, exactly, and it's right, and it's so we're not really trying to burn anything. We're just breaking down. We're stimulating that hormone again to break down those fat cells. So that tingle that you feel is all that process in motion. But no, again, you're not supposed to really feel a burning or a hot sensation after the treatment.
Yeah, it never felt like a heat to me, and the tingling after is delightful.
So no age restrictions really on this? Just people who want to address certain things? There's no restriction as far as how young or how old you need to be?
Again, more than an age restriction is how much we're going after. And if there's a lot of loose skin, we'll make the determination of whether the patient's a better candidate for a laser versus a surgical facelift. So yes, this is not going to replace patients that need surgery. If there's a lot of loose skin, we do have our facial plastic surgeons in the office, Dr. Lee Hockey, Dr. Barnes, that will send you over, and you'd probably be a better candidate for that. But again, in your case, where we're just doing it more for prevention, and if there's a little bit of looseness in the jowls or in the neck, you're a good candidate. If it's too dramatic, too drastic, then surgery is going to be the better treatment.
How about for like the arms or for the thighs? Was this also something that would work for those pockets also?
Absolutely. So with the arms, again, there's two things. After patients have lost weight, they actually get that laxity in skin, that looseness in their arms. And so this can actually tighten that up. Again, it kind of depends on how much laxity we're going after. If we're going to be tightening up just a few centimeters, the venous freeze is a wonderful option. If we're looking for a few inches, then surgery is going to be the better option. For the thighs, this machine works great to go after cellulite. It actually also gives you a little bit of firming as well, a little bit of toning. But if, again, after dramatic weight loss, if there's a lot of loose skin to go after, we'll send you over to one of our surgeons where they'll do a procedure like a thigh lift or something a little more,
That's
dramatic.
a thing? Is there a benefit to, like, let's say you do 4 half-hour sessions? Is that better than doing 2 1-hour sessions?
Great question. This machine is actually, it's very pre-programmed in terms of how much time we should address any given area for. And these pre-programmed times are in the machine from years and years of research on what works the best. And through different protocols, what scientists have found out that no, it's better to do 30 to 40 minutes, coming in once a week, hitting it pretty regularly. You kind of hit a plateau at a certain point, and doing more isn't always necessarily the best thing to do. But it's more quantity sometimes than quality of the treatment. Hitting it more often to get you the best results possible.
If people want more information, is this one of those things they can come in for a free consultation, or is there information online?
Both, absolutely. So, at our website, Beautologie.com, we have a lot of information on the treatment. It's actually Beautologie.com/Venus Freeze. The consultations are totally complimentary. We're at the office Monday through Friday. I myself am always there. I'd love to see the patients and give them all the information I can and see if there's a better option if this isn't the best treatment. And so, yep, absolutely.
How do I look?
You
You
look
have the
wonderful.
neck of Dakota Fanning.
Wow, thank you. Oh, thank you.
Well, you did great. You just got a little bit of pink. Again, we didn't hit the high temperatures we were hitting Scott at, so you're just a little pink, a little flushed, which is what we want.
Ooh.
And you may feel a little tingle, kind of like Scott did here in a few minutes. And it just feels just like that, just a little tingle. And usually that kind of wears off in about an hour or so, that tingling sensation.
Well, guys, I really appreciate you coming in. Thank you so much for sharing this with me. As always, it is great to see you. Scott, thanks for sticking around and talking for me.
I'm glad I got to watch that happen. You have the neck of a 13-year-old girl.
Thank you. Thank you so much. All right, guys. Again, thank you to Scott. Thank you to Dr. Shah. Thanks to Nurse Lilly. Guys, come back and see us anytime. We really appreciate it. Up next, don't go away. We're going to see if my neck goes. Oh, look, you can't even tell. Right? Can't even tell. Preview the June graduate issue of Bakersfield Life magazine, so don't go away because you're watching Live Well on Bakersfield.com.